Welcome to This Week in Allergy and Immunology. This week, we're covering 10 notable papers spanning early life allergy prevention and microbiome dynamics, advanced management strategies for severe asthma and type 2 airway diseases, and novel therapeutic interventions for systemic and localized allergic disorders. Let's dive in. We begin with a focus on early life factors and allergy prevention. In a study, Walker and colleagues investigated whether maternal prebiotic supplementation could modify the known risks associated with intrapartum antibiotic exposure. The trial involved pregnant women whose infants had a strong family history of allergic disease. Mothers were randomized to receive either daily prebiotics, consisting of galacto-oligosaccharides and fructo-oligosaccharides, or a maltodextrin placebo from 18 to 20 weeks of gestation until 6 months postpartum. The study revealed that a high proportion of mothers, over 83%, received antibiotics during the trial. In the placebo group, exposure to intrapartum antibiotics was associated with a more than 3.5-fold increase in the risk of infant allergen sensitization, an almost 6-fold increase in the risk of IgE-mediated food allergy, and a more than 6-fold increase in the risk of medically diagnosed atopic eczema. Remarkably, these elevated risks were completely absent in the group of infants whose mothers consumed prebiotics. This suggests that maternal prebiotic supplementation may act as a protective buffer against the dysbiotic effects of intrapartum antibiotics, representing a simple and scalable preventative strategy. In a related study also, Shen and colleagues utilized deep shotgun metagenomic sequencing to examine how the infant skin microbiome and host genetics influence the development of distinct atopic phenotypes. Analyzing over 1,000 skin swabs from 429 infants in the Vitality cohort at 2 to 3 months and 12 months of age, the researchers found that specific skin microbiome signatures emerge before and after clinical disease onset. At 12 months, infants with atopic dermatitis alone showed an enrichment of Staphylococcus epidermidis, whereas those with co-occurring food allergy exhibited a depletion of Staphylococcus hominis and Lactococcus species, alongside an enrichment of Dermacoccus nichinomiensis and Malassezia sleuthiae. Crucially, early skin dysbiosis at 2 to 3 months, characterized by an enrichment of Staphylococcus species, was associated with the subsequent development of atopic dermatitis with food sensitization or food allergy, but not atopic dermatitis alone. Furthermore, infants carrying filagra null mutations who developed atopic dermatitis showed distinct microbial shifts, including reduced Streptococcus species. These insights suggest that early skin microbiome profiling could play a significant role in early risk stratification and targeted interventions. Moving to airway diseases, we look first at a consensus paper from the Journal of Allergy and Clinical Immunology in Practice that addresses treatment targets in severe asthma. With the success of biologic therapies, achieving clinical remission is increasingly discussed, yet it remains out of reach for many patients with long-standing or severe disease. To address this, Couillard and an international steering committee conducted a systematic literature review and a modified Delphi consensus process to define both remission and a less stringent, highly practical treatment target called minimal clinical disease activity, or MCDA. These definitions establish clear, multi-domain criteria spanning asthma exacerbations, systemic corticosteroid use, lung function, and patient-reported quality of life. This framework provides clinicians with standardized, realistic milestones to guide therapeutic escalation or maintenance in severe asthma management. In a related clinical investigation, Vaith and colleagues evaluated the frequency and clinical relevance of residual bronchodilator responsiveness in adults with moderate to severe asthma who were already receiving maintenance therapy. In a cohort of 248 adults, the researchers withheld short-acting bronchodilators for 12 hours, but continued regular maintenance therapy before performing spirometry. They found that residual bronchodilator responsiveness was present in approximately 23% of patients on active maintenance. Patients with this residual responsiveness had significantly higher type 2 inflammatory biomarkers, including sputum eosinophils and fraction of exhaled nitric oxide, despite receiving high-dose inhaled corticosteroids. They also demonstrated more frequent fixed airflow obstruction, greater small airway dysfunction, poorer asthma control, and a higher rate of frequent exacerbations. This simple, widely available physiological marker effectively identifies a subset of patients with refractory type 2 inflammation and high residual disease burden who may benefit from treatment optimization or biologic therapies. For patients with severe upper airway type 2 disease, a post-hoc analysis of the Phase 3 Waypoint trial. Asthma and Immunology evaluated the efficacy of the anti-TSLP monoclonal antibody, tezepelumab, in severe chronic rhinosinusitis with nasal polyps. Fujita and colleagues assessed outcomes across subgroups defined by the Japanese Epidemiological Survey of Refractory Eosinophilic Chronic Rhinosinusitis, or ECRS. Among 408 patients randomized to receive tezepelumab 210 mg or placebo every 4 weeks, tezepelumab demonstrated robust and consistent efficacy. At week 52, patients treated with tezepelumab showed substantial reductions in both the total nasal polyp score and the biweekly mean nasal congestion score compared to placebo, regardless of whether they belonged to the non-ECRS, mild, moderate, or severe eosinophilic subgroups. Secondary outcomes, including olfactory improvement, quality of life scores, and the need for surgery or systemic corticosteroids, were also consistently improved, reinforcing tezepelumab's potential as a highly effective treatment across the entire spectrum of severe chronic rhinosinusitis with nasal polyps. Next, we examine advances in novel therapeutics and delivery systems. In the field of chronic spontaneous urticaria, Hyde and colleagues published a Phase 2a randomized double-blind trial in Allergology International evaluating TAS 5315, a novel once-daily oral Bruton's tyrosine kinase or BTK inhibitor. The study randomized 126 patients with moderate to severe urticaria inadequately controlled by second-generation H1 antihistamines to receive one of 5 active doses of TAS 5315 or placebo for 12 weeks. The primary endpoint was the change from baseline in the Weekly Urticaria Activity Score, or UAS-7, at week 12. The mean reductions in UAS-7 were notable across all active treatment arms, ranging from approximately 11.6 to 17.8 points, compared to a reduction of 9 points in the placebo group. The drug was well tolerated, with most adverse events being mild, and petechiae was identified as the most common adverse event. This trial highlights oral BTK inhibition as a promising, needle-free therapeutic avenue for antihistamine-resistant chronic spontaneous urticaria. Addressing another needle-free innovation, a study in the Annals of Allergy, Asthma, and Immunology detailed 5 human factors studies evaluating the safety and usability of the newly approved intranasal epinephrine spray, known as Neffy. Hernandez Trujillo and colleagues evaluated 204 participants, including adult and adolescent allergy patients, caregivers, healthcare professionals, and untrained bystanders, across simulated anaphylaxis scenarios. Using only the device and its quick reference guide, all participants successfully administered both single and repeated doses of the air-filled device, without any dosing errors. Minor, harmless usability issues identified in early design phases were successfully resolved through iterative refinements to the labeling and carrying case. This validation demonstrates that the final approved labeling supports reliable and correct administration of intranasal epinephrine, potentially overcoming common barriers such as needle phobia and device complexity in emergency settings. For patients with eosinophilic esophagitis, a systematic review and meta-analysis published in the International Archives of Allergy and Immunology pooled the evidence for the anti-IL-4 receptor alpha monoclonal antibody, dupilumab. Khalaf and colleagues analyzed 19 studies comprising 760 pediatric and adult patients. The meta-analysis revealed a pooled histologic remission rate, defined as 15 or fewer eosinophils per high-power field, of 75.5%. Additionally, the pooled rate of clinical symptom improvement was 84.1%. The therapy was highly effective across both adult and pediatric cohorts, with some pediatric cohorts achieving remission rates up to 90%, solidifying dupilumab's role as a key therapeutic option for patients struggling with refractory eosinophilic esophagitis. Our final theme explores diagnostic and management models in clinical immunology. A study in allergy utilized time-resolved multi-omics to help clinicians distinguish systemic allergic reactions from immunization stress-related responses following mRNA COVID-19 vaccination. Oliveira and colleagues profiled blood samples from a double-blind, placebo-controlled revaccination trial of individuals who had experienced immediate reactions to their first dose. The researchers found that vaccine-induced antiviral transcriptional programs and long-term humoral immunity were fully preserved regardless of whether a patient experienced a reaction. However, the biological profiles of the reactions themselves were highly distinct. Immunization stress-related responses were characterized by an acute stress metabolic state, featuring early increases in norepinephrine, sustained elevations of glycolytic intermediates like bisphosphoglycerate, and a downregulation of basophil activation markers and transcripts. Conversely, true systemic allergic reactions demonstrated opposite metabolic trajectories and a trend toward early neutrophil activation. These distinct molecular signatures offer a path toward developing objective biomarkers to differentiate true allergic reactions from stress responses, helping to prevent unnecessary vaccine avoidance. Finally, a review in the Journal of Allergy and Clinical Immunology in Practice emphasizes the growing role of shared decision-making and health-related quality-of-life assessments in managing inborn errors of immunity. Lawrence and colleagues discuss how advances in genetic testing and newborn screening have transformed the management landscape, making patient-reported outcomes critical. The authors highlight the clinical value of incorporating validated tools, such as the sulfur monofluoride 36, pediatric quality-of-life inventories, and disease-specific measures like the Common Variable Immunodeficiency Quality of Life Questionnaire, into routine care. They illustrate how shared decision-making is essential when navigating complex clinical decisions, such as initiating immunoglobulin replacement therapy, starting prophylactic antibiotics, administering interferon gamma in chronic granulomatous disease, or proceeding to hematopoietic stem cell transplantation. Balancing clinical trial data with individual patient values, treatment burdens, and financial implications is key to optimizing long-term outcomes in this complex patient population. If you only have time for one paper this week, make it the study on maternal prebiotic supplementation and infant allergy risk by Walker and colleagues in Allergy. This paper provides compelling, high-quality evidence that a simple, low-cost dietary prebiotic intervention during pregnancy and the early postpartum period can completely neutralize the dramatic increase in infant food allergy, eczema, and allergen sensitization risks associated with intrapartum antibiotic exposure. Here are the key takeaways from this week in Allergy and Immunology. First, maternal prebiotic supplementation with galacto and fructo oligosaccharides during late pregnancy and lactation can mitigate the heightened risk of infant food allergy, eczema, and sensitization associated with intrapartum antibiotic use. Second, early life skin dysbiosis, specifically the enrichment of Staphylococcus species at 2 to 3 months of age, predates and predicts the development of atopic dermatitis with co-occurring food allergy or sensitization. Third, testing for residual bronchodilator responsiveness in patients on active asthma maintenance therapy is a practical clinical marker that identifies individuals with persistent type 2 inflammation, small airway dysfunction, and poor disease control. Fourth, the intranasal epinephrine spray, neffy, can be successfully and accurately administered by untrained bystanders and caregivers during simulated anaphylaxis, offering a reliable needle-free rescue option. And finally, dupilumab achieves high rates of both histologic remission and symptom improvement in patients with eosinophilic esophagitis, serving as a highly effective option for those who fail standard first-line therapies. That's your roundup for this week in Allergy and Immunology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.